Hello viewers, thank you so much for joining me on this channel. I have been blown away by the response I have received to my videos, and there have been some frequently asked questions, especially about MRCS Ent Osce. In this video, I'll try to answer those questions to the best of my ability. So let's get into it. The first question that many have asked is, what is the cutoff for passing MRCS Ent Osce? Now, I don't have historical data on this topic, but I think that the pass mark for MRCS Ent Osce is slightly higher than the pass mark for MRCS Part A. In my session, the pass mark was somewhere around the range of 360 out of 520. I think it was 363 to be exact, but the pass mark usually is in that range, 360 to 370 out of 520. I managed to get 407, so I was comfortably above the cutoff mark. But this is usually the range, 360 to 370. But again, historical data does not mean a lot. It might be different for your session. So I would urge you to aim somewhere in the range of 80 to 85%. If you get that, you are safe. The next question that I was asked is, how many attempts are allowed for MRCS Ent Osce? Now this is a question I should have answered in the video that I made on MRCS Ent Osce. You are allowed 4 attempts. 4. For MRCS Part A, you are allowed 6 attempts, but for MRCS Ent Osce, you are allowed 4 attempts. So you have to pass the exam in those 4 attempts. You will not be allowed a 5th attempt. How soon after passing MRCS Part A should I pass MRCS Ent Osce? This is a very important question. The moment you have passed MRCS Part A, the clock starts ticking, and you have about 7 years from the date of passing MRCS Part A to appearing in MRCS Ent Osce and passing MRCS Ent Osce. So these 4 attempts that you are allowed, they should be covered in those 7 years from the date of passing MRCS Part A. This is of critical importance. You should pass MRCS Ent Osce within 7 years of passing MRCS Part A. And as I said, you are allowed a maximum of 4 attempts. What is the optimum duration of preparation for MRCS Ent Osce? This is a question that did plague me as well. So when I passed MRCS Part A in September 2022, I knew I had 7 years, but I did not know what is the minimum duration which is required to pass MRCS Ent Osce. Because of course MRCS Ent Osce involves traveling to the UK. It is an expensive exam, not just in terms of exam fees, but also with the associated costs of traveling and other costs. So I did my research and I felt that MRCS Ent Osce requires about 3 months of quality preparation. I did pass MRCS Part A in September 2022 and I was eligible for the MRCS Ent Osce in February of 2023. I had received the result in October, if I'm not wrong, October of 2022. So I had the months of November, December and January, 3 months to prepare for the February exam, February MRCS Ent Osce exam, and I felt those 3 months would have been enough. But I chose to prepare for 6 months and I appeared in MRCS Ent Osce in the month of May of 2023. And I was very certain about my preparation and I also was able to pass comfortably. So I think the optimum duration of preparation for MRCS Ent Osce is anywhere between 3 to 6 months. How difficult are the questions in MRCS Ent Osce? This is very important. The questions are not difficult, but if you don't know what kind of answers are expected from you, then you might fall into a trap. The questions of MRCS Ent Osce in the Indian context is largely of first year of post-graduation level. So it is not of consultant level. It's of first year of post-graduation level. So you should answer questions appropriately. For example, if the question is about orbital complications of chronic rhinosinusitis and the question is, how would you treat this patient? You should not start with orbital decompression. Although that might be the definitive management according to you, you should start with I will perform a thorough evaluation. I will call the ophthalmology on call. I'll go for radiological investigations in that stepwise manner. So just to keep it simple, the difficulty level of MRCS Ent Osce is at a first year postgraduate level, or as they say in the UK, ST3 level, not at the consultant level. How difficult is it to communicate with native speakers of the English language? This is a question that did give me some sleepless nights, because I did anticipate a situation where people would be communicating with me in the native English accent and I would not be able to understand them. But that is not the case, because your accent is as difficult for them to comprehend as their accent is to you. So what ends up happening is both sides end up communicating in a very slow, deliberate manner, which facilitates easy comprehension. So don't worry about difficulty in understanding the spoken word of the native English speaker. Another question that people asked me was, why did I go for MRCS ENT and not for DONS? The simple answer is DONS does not exist anymore. So earlier there were two pathways towards training in the UK for ENT. One was the DONS pathway, DOHNS, Diploma in Otolaryngology and Head Neck Surgery, and the other one was the MRCS ENT pathway. So there was a MCQ question called DONS paper 1, which was just multiple choice questions on ENT. That doesn't exist anymore. It has been replaced by MRCS Part A, and the DONS OSCE has been replaced by MRCS Ent Osce. So the DONS Part 2 is now called MRCS Ent Osce. So DONS does not exist anymore. If you want to get into the Royal College through the ENT route, you have to appear in MRCS Part A, which has made life a little more difficult for us because we have to read so much of general surgery. But it is well worth the effort. You should pass MRCS Part A and then you appear for MRCS Ent Osce, which is largely similar to the DONS OSCE that used to happen earlier. MRCS Part A, MRCS Ent Osce, and then you become a member of the Royal College of Surgeons through the ENT route. So what happened to DONS? It changed into MRCS Ent Osce, and DONS Part A does not exist anymore. Thank you so much for watching. I hope I was able to answer the unanswered questions adequately. If you feel you want to ask more questions, then feel free to ask in the comment section and I will definitely get back to you. Take care. I hope to see you in the next video soon.